Stop. Before you swallow another pill tonight, listen carefully, because what I'm about to tell you could save your heart. I'm not a doctor standing in a white coat with a stethoscope around my neck. I'm just someone who cares deeply about your well-being. Someone who has seen too many older adults suffer needlessly because they didn't have the right information at the right time. What I am about to share isn't meant to scare you, it's meant to empower you. It's about taking control of your health when it matters most. Every single night, millions of seniors across America reach for their pill organizers, trusting that these tiny tablets will help them feel better, live longer, and maintain their independence. But what if I told you that some of these very pills, the ones you've been taking faithfully for years, might actually be quietly damaging your heart? Not all medications, of course. Not every pill. But certain common ones, especially when combined with others or taken by older bodies that process medications differently, can have devastating effects on heart health that most people never see coming. This isn't about fear-mongering. This is about awareness. This is about understanding that as we age, our bodies change in ways that make us more vulnerable to medication side effects that younger people might breeze through without a second thought. Your liver doesn't process drugs as efficiently. Your kidneys don't filter them as quickly. Your heart muscle has been working hard for decades and might not handle certain chemical stresses the way it used to. And yet, many seniors are on multiple medications, sometimes 5, 10, or even 15 different pills every day, without anyone taking a step back to ask, is this combination actually safe for an 80-year-old body? I know this sounds alarming. I know you might be thinking, but my doctor prescribed these. And that's exactly the point. Doctors are incredible healers, but they're often working with limited time, incomplete information about how medications interact in older bodies, and sometimes outdated guidelines that don't reflect the latest research on senior health. You see, most medication studies are done on younger adults, people in their 30s and 40s, so we don't always have good data on how these drugs affect 70, 80, and 90-year-olds. It is like trying to drive a car with a map that only shows half the roads. You might get where you were going, but you could also end up in dangerous territory without realizing it. Let me share something that hit close to home for me. My neighbor, Mrs. Henderson, was a vibrant 78-year-old who loved gardening, bridge tournaments, and spoiling her grandchildren. She took 7 different medications for various conditions: blood pressure, cholesterol, arthritis, and sleep issues. She trusted her doctor completely, never questioning the prescriptions. Then one morning she didn't wake up. The autopsy revealed significant heart damage, not from a heart attack, but from medication interactions that had been silently weakening her heart muscle over time. Her family was devastated. They had no idea this could happen, and the most heartbreaking part? It might have been preventable with better awareness and communication. This isn't an isolated story. Across the country, emergency rooms are seeing more and more seniors admitted with heart problems that trace back to medication side effects. The statistics are sobering. Adults over 65 are twice as likely to be hospitalized for adverse drug reactions compared to younger adults. And heart-related medication complications are among the most common and dangerous. But here's the thing, most of these situations are preventable. You don't have to be a victim of well-intentioned but potentially harmful prescriptions. So what can you do? First, and most importantly, never stop taking prescribed medications without talking to your healthcare provider. That's crucial. What I'm advocating for isn't to rebellion against medicine, it's informed partnership with your healthcare team. It's about asking the right questions and being your own best advocate. Start by creating a complete medication list. Not just prescriptions, but over-the-counter drugs, supplements, vitamins, and even herbal remedies. Many seniors don't realize that something as seemingly harmless as a daily multivitamin or an occasional sleep aid can interact dangerously with prescription medications. Write down everything, every pill, every drop, every capsule. Include the dosage, how often you take it, and why you take it. Keep this list in your wallet, on your phone, and on your refrigerator. Update it whenever anything changes. Next, schedule a medication review. Not just a regular doctor's appointment, but a dedicated session where the sole focus is reviewing every single medication you take. Ask specifically, is this medication still necessary for me at my age? Are there safer alternatives that might be better for my heart? Could any of these medications be interacting with each other in harmful ways? Many pharmacies offer free medication reviews with pharmacists who specialize in geriatric care. They often have more time to look at the big picture than busy doctors do. Here is another critical step that many seniors overlook. Pay attention to the timing of your medications. Some drugs should never be taken together because they compete for the same metabolic pathways in your liver. Others might amplify each other's side effects. For example, taking certain blood pressure medications with common over-the-counter pain relievers can dramatically increase heart risks. Your pharmacist can help you create a safe medication schedule that minimizes these dangerous interactions. But let's talk specifically about heart health, because that's what we started with. As we age, our hearts naturally become less elastic. Our arteries may harden, and our heart's electrical system can become more sensitive. Certain medications can exacerbate these natural changes in ways that aren't immediately obvious. For instance, some common antidepressants, antihistamines, and even medications for overactive bladder can prolong what's called the QT interval on an electrocardiogram, subtle change that can lead to dangerous heart rhythms in susceptible older adults. Nonsteroidal anti-inflammatory drugs, NSAIDs, the kind you buy over the counter for pain and inflammation, are particularly problematic for senior hearts. Drugs like ibuprofen and naproxen can increase blood pressure, cause fluid retention, and actually increase the risk of heart attack and stroke in older adults, especially when taken regularly or in combination with blood pressure medications. Many seniors pop these pills like candy for aching joints, not realizing they might be trading short-term pain relief for long-term heart damage. Then there are the sleeping pills. Oh, how I understand the desperation of lying awake at 3 a.m., your mind racing while your body aches. But many common sleep medications, especially benzodiazepines and certain Z drugs like zolpidem, have been linked to increased fall risk, cognitive decline, and yes, heart problems in older adults. The American Geriatric Society actually lists many of these drugs as potentially inappropriate for seniors. Yet they're still widely prescribed. What if I told you that natural sleep hygiene techniques, consistent bedtimes, limiting screen time before bed, creating a dark, quiet sleep environment could be more effective and much safer in the long run? Blood pressure medications are another complex area. While controlling high blood pressure is crucial for heart health, aggressively lowering it in older adults can sometimes do more harm than good. Very low blood pressure can lead to dizziness, falls, and actually reduce blood flow to the heart and brain. The goal isn't necessarily the same blood pressure number you had at age 40. It's finding the right balance for your 70 or 80-year-old body. This requires careful monitoring and frequent adjustments. Cholesterol medications, particularly statins, are another category that deserves careful consideration in seniors. While statins save lives by preventing heart attacks and strokes, they can also cause muscle pain, weakness, and in rare cases, actually affect heart muscle function. For very old adults or those with multiple health conditions, the benefits might not outweigh the risks. This isn't about avoiding statins altogether, it's about having an honest conversation with your doctor about whether they are still the right choice for you at this stage of life. Diabetes medications present similar challenges. Tight blood sugar control is important, but in older adults, the risk of dangerously low blood sugar, hypoglycemia, can be more dangerous than slightly elevated blood sugar. Some diabetes drugs have been associated with heart failure risks. Again, this isn't about stopping medication, it's about finding the right balance for your age and overall health picture. This is where you come in. You must become the CEO of your own healthcare team. Don't be afraid to speak up. If a new medication is prescribed, ask, why is this necessary? What are the alternatives? How will this interact with my other medications? What are the potential heart-related side effects I should watch for? Write down the answers. Bring a family member or friend to appointments to help remember the details. Your health is too important to leave to chance. But medication safety is only part of the story. True heart health for seniors involves a holistic approach that goes far beyond pills. Let's talk about nutrition, real, whole foods that nourish your heart and your entire body. The Mediterranean diet isn't just a trend, it's backed by decades of research showing it can reduce heart disease risk, improve brain function, and even help you live longer. This means focusing on fruits, vegetables, whole grains, lean proteins like fish and poultry, healthy fats from olive oil and nuts, and limiting processed foods, added sugars, and excessive salt. I know what you might be thinking, but I've eaten the same way my whole life. I get it. Change is hard, especially when you're older. But small, gradual changes can make a big difference. Start by adding 1 extra serving of vegetables to your dinner. Swap that afternoon cookie for a handful of walnuts and berries. Choose water over sugary drinks. These small steps add up over time and can significantly improve your heart health without requiring a complete dietary overhaul overnight. Physical activity is another cornerstone of senior heart health, but it doesn't. Do you have to mean running marathons or spending hours in the gym? Gentle movement matters more than intensity. A daily 20-minute walk around your neighborhood can strengthen your heart, improve circulation, help control blood pressure, and even boost your mood. Chair exercises, Tai Chi, water aerobics, these are all excellent options for seniors who may have mobility limitations or joint pain. The key is consistency, not intensity. Your heart responds to regular, gentle movement much better than occasional intense workouts followed by days of inactivity. Stress management is often overlooked but critically important for heart health. Chronic stress releases hormones like cortisol that can damage your heart over time, increase inflammation, and raise blood pressure. For seniors, stress might come from health concerns, financial worries, loneliness, or caring for a spouse. Finding healthy ways to manage stress isn't just good for your mind, it's essential for your heart. This might mean daily meditation, deep breathing exercises, spending time in nature, connecting with friends, or engaging in hobbies that bring you joy. Even 5 minutes of deep breathing each morning can make a measurable difference in your stress levels and heart health. Quality sleep is another vital component. Poor sleep doesn't just leave you tired. It actually increases inflammation in your body, disrupts hormones that regulate appetite and blood sugar, and puts extra strain on your heart. Many seniors struggle with sleep as they age, but sleeping pills aren't the answer. Instead, focus on creating good sleep habits. Keep your bedroom cool and dark, avoid screens for an hour before bed. Establish a relaxing bedtime routine and try to go to bed and wake up at the same time every day, even on weekends. Social connection might seem unrelated to heart health, but the research is clear. Loneliness and social isolation are as damaging to your heart as smoking 15 cigarettes a day. Seniors who maintain strong social connections have lower rates of heart disease, recover better from illness, and live longer, healthier lives. Make an effort to connect with others daily, even if it's just a phone call to a friend, a visit with a neighbor, or joining a senior center activity. Your heart literally thrives on human connection. Regular health screenings are essential, but they need to be tailored to your age and individual risk factors. Blood pressure checks, cholesterol tests, blood sugar monitoring, these are important. But so are less routine tests like checking for inflammation markers or assessing heart rhythm abnormalities that might not show up on standard tests. Don't just accept normal test results without understanding what they mean for you personally. Ask your doctor to explain your numbers in the context of your age, overall health, and personal risk factors. Fall prevention might not seem like heart health, but falls are a leading cause of injury and death in seniors, and recovering from a fall often requires multiple medications that can further strain your heart. Make your home safer by removing tripping hazards, installing grab bars in bathrooms, ensuring good lighting, and using assistive devices if needed. Staying upright and independent is one of the best things you can do for your overall health, including your heart. Hydration is another simple but powerful tool for heart health. Dehydration thickens your blood, making your heart work harder and increasing the risk of blood clots. As we age, our sense of thirst diminishes. So many seniors don't drink enough water. Aim for at least 8 glasses daily, more if you're active or in hot weather. Water is best limits sugary drinks and excessive caffeine, which can actually dehydrate you. The relationship between mental health and heart health is profound. Depression and anxiety aren't just emotional challenges, they have real physical effects on your heart, including increased inflammation, higher blood pressure, and disrupted heart rhythms. If you're feeling persistently sad, anxious, or hopeless, don't dismiss it as just part of aging. These feelings are treatable, and addressing them can significantly improve your heart health and overall quality of life. Let me address something that many seniors struggle with. The feeling that they being a burden by asking too many questions or taking up too much of their doctor's time. I want to be crystal clear about this. You are not a burden. Your health matters. Your life matters. Good healthcare providers want engaged, informed patients. They know that patients who understand their treatment are more likely to follow through and have better outcomes. If your doctor dismisses your concerns or makes you feel rushed, it might be time to find a new healthcare provider who values your partnership in your care. I also want to talk about the financial aspect of medication safety. Many seniors skip doses or split pills to save money, not realizing this can be incredibly dangerous, especially for heart medications that need to be taken. consistently at specific doses. If cost is a concern, speak openly with your doctor and pharmacist. There are often generic alternatives, patient assistance programs, or different medications that work just as well but cost less. Your local area agency on aging can also help connect you with resources to make medications more affordable. What about supplements? Many seniors take vitamins and supplements thinking they're harmless insurance policies for health. But supplements aren't regulated like medications. They can vary widely in quality and potency, and many interact dangerously with prescription drugs. For example, St. John's wort, often taken for mild depression, can reduce the effectiveness of blood thinners, heart medications, and many other drugs. Fish oil supplements, while beneficial for heart health, can increase bleeding risk when combined with blood thinners. Always discuss any supplements with your doctor or pharmacist before taking them. Let's circle back to that hook I started with about pills damaging hearts. I want to be very clear. I'm not saying all medications are bad or that you should stop taking your prescriptions. Medications save lives and improve quality of life for millions of seniors every day. What I'm saying is that we need to be smarter about how we use them, especially as we age. We need to recognize that our bodies change, our medication needs change.